imagine a discomfort that's hard to pinpoint, maybe a persistent ache, or just a subtle change in your daily routine that feels, well, off. Now, picture that for a horse. Today, we're taking a deep dive into a condition that, while it's not super common, can cause exactly that kind of hidden distress and some really unique challenges for our equine friends. Equine urolithiasis, or as most people know it, urinary stones in horses. Our mission today is to really unpack what these stones are, why they form, how vets find them and treat them, and crucially, how we might prevent them.
And it is quite surprising, actually, because horses naturally produce a remarkable amount of calcium carbonate in their urine. It's just part of their normal physiology. So the fact that these stones are actually pretty rare, it hints at some very interesting protective mechanisms going on, maybe unique urinary proteins perhaps, or even just a faster urine flow that stops crystals clumping together. We'll definitely explore that as we journey through this rather complex issue.
Okay, right. Let's unpack this then. So at its core, urolithiasis means these macroscopic concretions of urine crystals, basically stones, or calculi, I suppose is the technical term. And they can show up anywhere in the urinary tract. And you also mentioned sabulous urolithiasis. What's that exactly?
Yes, that's a bit different. It's more like an accumulation of large masses of urine sediment. Think thick sludge building up in the bladder, not necessarily a distinct hard stone.
Sludge, right. Okay, so how common is this whole issue, really?
It's genuinely uncommon. Statistics from teaching hospitals show it affects maybe only about 0.11% of equine admissions, so really low overall. But here's the kicker. If a horse does come in with a urinary tract disorder, urolithiasis suddenly accounts for about 8% of those specific cases. So while it's rare generally within that specific subset of urinary problems, it becomes a significant diagnosis to consider.
Okay, that puts it in perspective. So if a horse does develop these stones, what are they actually made of?
The vast majority, the main component is calcium carbonate, specifically the mineral form called calcite. And we tend to see two main types. One is kind of rough, spiculated, and interestingly, relatively easy to fragment or crumble. The other type is quite different, white-gray, smooth, almost polished looking, and very resistant to crushing.
Ah, okay.
And that distinction, it's really crucial when you're thinking about treatment. It totally changes how a vet might approach getting it out.
Yeah.
We do see less common types too, like struvite or calcium phosphate, and of course that sabulous sludge we mentioned.
That's fascinating, the different textures. And it makes you wonder, thinking about horses specifically, why calcium carbonate? Why is that the dominant type?
Yeah, if we connect this to the bigger picture, it really is all about their specific physiology. Normal horse urine is typically alkaline, right? And it naturally has a really high mineral content, especially calcium. Plus, it contains significant amounts of these things called mucoproteins.
Mucoprotein.
Yeah, they can act as sort of binding substrates, like a glue for these minerals. So this whole environment, alkaline urine, high calcium, plus those mucoproteins, it's just highly conducive to calcium carbonate crystals forming, which is exactly why prevention strategies have to target these unique equine factors, not just, general stone prevention ideas from other species.
Right, it's tailored to the horse. So once these stones form, where do they usually end up? Where do they cause problems?
Bladder stones, or cystoliths, are definitely the most common. They account for something like 60% of all cases. Then you've got urethrolyths, stones in the urethra, at about 24%. After that, it's nephroliths, which are kidney stones, around 12%. And then ureteroliths, stones in the ureters, are the least common at about 4%.
Okay, so mostly bladder.
Mostly bladder, yeah. But here's an important point. We often find what are called multifocal calculi, meaning stones in more than one spot. This happens in roughly 10% of affected horses. And interestingly, if a horse does have a ureteral stone, there's a very high chance, like 87%, they also have kidney stones concurrently. Yeah, so it really highlights that a comprehensive check of the entire urinary tract, kidneys, ureters, bladder, urethra is absolutely essential during diagnosis. You can't just stop at the first stone you find.
That makes perfect sense. You need the full picture. So given all that, who is most likely to get these stones? Are certain horses more susceptible?
It definitely seems to affect adult horses more. The mean age is usually around 10 years old, and here's a really significant detail. About 75%, so 3/4 of reported cases are in males, stallions and geldings.
75%. That's a huge difference between males and females. Why is that?
It really boils down to anatomy. It's a clear anatomical predisposition. Male horses, geldings, and stallions have a much longer urethra, and it's also less distensible, meaning it doesn't stretch as easily compared to a mare's.
Uh-huh.
So it's just physically much harder for any stones that form to pass out. They're far more likely to get stuck and cause an obstruction.
Yeah.
Mares, on the other hand, have a shorter, wider urethra. They can often expel smaller stones without anyone even noticing. They might be completely asymptomatic or undiagnosed.
Right, so the plumbing is just different. Okay, so beyond anatomy, what other factors play into stones forming? Is diet a big one?
Diet is definitely a major player, absolutely. Feeds that are high in calcium, like alfalfa hay or other legume hays, are strongly implicated as risk factors. But here's something that's kind of tricky. While the instinct is to restrict dietary calcium, some strategies used to acidify urine can, paradoxically, actually increase the amount of calcium excreted into the urine.
Oh, really?
Yeah, so it creates this sort of nuanced challenge for prevention. It's not always straightforward. And of course, inadequate water intake is huge. That leads to more concentrated urine, which just makes stone formation much more likely. It also increases the risk for urinary tract infections, UTIs.
Okay, so diet, water.
Hmm.
What about the bladder itself? Can problems with how the bladder functions contribute?
Oh, without a doubt. Urinary stasis, basically, incomplete bladder emptying, is a really potent risk factor. If the bladder isn't emptying fully, that urine sits there and it allows that thick, sandy sediment we talked about, the sabulous material, to accumulate. That's sabulous cystitis.
Right, the sludge.
Exactly. And that sludge mechanically irritates the bladder lining. That irritation can then further impair the bladder's ability to contract properly, which leads to more incomplete emptying. You see the cycle.
Yeah, a vicious cycle.
It really is. And then you have anatomical issues too, maybe like a narrowing of the urethra, perhaps from an old injury or a previous surgery, or even congenital things like ectopic ureters, which is where one or both ureters, the tubes from the kidneys, don't connect to the bladder in the right place. That can cause constant dribbling and predispose them to problems.
Okay. What about infections? Do UTIs cause stones or do stones cause UTIs? Or both?
It can absolutely be bidirectional, like a chicken and egg situation sometimes. Certain types of infections can contribute to stone formation, especially some specific stone types like struvite, which are associated with certain bacteria. But maybe more commonly, the presence of the stones themselves rubbing against the bladder or urethral lining damages that lining. It compromises the tissue's normal defense mechanisms, making it much more vulnerable to getting recurrent or persistent UTIs.
Ah. Wow.
So effective treatment really has to address both things. You need to get rid of the stone and clear up any associated infection at the same time.
That makes sense. So thinking bigger picture then, are there sometimes deeper underlying causes, maybe things not directly related to the urinary tract itself, like neurological issues?
That's a really, really important question. Yes.
Yeah.
A wide range of neurological disorders can actually cause bladder dysfunction. If the nerves controlling the bladder aren't working right, it can lead to that incomplete emptying urinary retention, and that predisposes the horse to sabulous urolithiasis, that sludge buildup. And sometimes it's not even overtly neurological. Even chronic musculoskeletal pain, maybe in the lower back or the hind limbs, can make it difficult or painful for a horse to adopt the correct posture to urinate properly. If they can't posture correctly, they might not empty their bladder fully, leading to urine retention over time.
Wow, I wouldn't have thought of back pain causing urinary issues.
It's all connected, right? So that's why a thorough neurological exam is often considered a really essential part of the diagnostic workup, even if the main complaint seems purely urinary.
Okay, that's a lot of potential causes. So if a horse does have stones, what kind of signs might an owner or a vet actually see? What does it look like?
Well, frustratingly, many of the signs can be pretty non-specific, which can make the initial diagnosis a bit challenging. You might see changes in how much water they drink, or they might urinate really frequently, just small amounts. That's called polyuria. Or they might strain or show pain when they urinate this urea. Blood in the urine, hematuria, is also common. And colic signs are definitely something we see, especially if a stone causes a blockage or significant irritation. That can look like typical colic restlessness, sweating, looking at their flank, lower abdominal pain.
Okay, so a range of signs. Does the location of the stone change the specific symptoms you might expect, like bladder versus urethra?
Yes, definitely. For bladder stones, those classic signs are difficulty urinating, dysuria, frequent small urinations, polyuria, and blood in the urine, hematuria. And here's a particularly telling detail. The blood, the hematuria, is often most noticeable after the horse has exercised.
After exercise, why that?
Well, the thinking is that the movement jostles the stone around in the bladder, causing more irritation to the bladder wall. And another clue is that the blood often appears towards the end of the urination stream.
Ah,
That specific pattern blood after exercise at the end of the stream strongly suggests the source of the bleeding is lower down in the bladder or urethra where the stone is likely bumping around rather than higher up like the kidneys. That's a good clinical indicator.
that's a neat clinical pearl. What about urethral stones then?
With urethral stones, you might see similar signs like incontinence or bloody urine, but the big danger here is a complete urethral obstruction. That is a true life-threatening emergency. The horse will show severe colic signs, very restless, sweating profusely, constantly straining and posturing, trying to urinate, but nothing comes out or just dribbles. That needs immediate, urgent veterinary attention and intervention. There's no time to waste.
Yeah, that sounds incredibly serious and scary for an owner. So if stones aren't treated or if they cause chronic problems, what are the potential long-term issues?
Well, the consequences can be severe. Untreated uroliths can lead to kidney damage, potentially progressing to kidney failure. The bladder itself can rupture, which is often fatal. Or the bladder muscle can become so overstretched from chronic retention that it loses its tone and ability to contract. That's chronic bladder paralysis, or atony. That can be irreversible. And as we mentioned, recurrent UTIs are very common, which just keeps damaging the urinary tract and makes management much harder.
Okay, so definitely something needing diagnosis and treatment. If you suspect stones, how do vets typically figure it out? What's the diagnostic process?
It always starts with a really detailed history from the owner. Vets will be looking for clues, maybe subtle signs that have been going on for months or even years before things became obvious. Then a thorough physical exam. For bladder stones, often a vet can actually feel the stone during a rectal palpation, especially in geldings or stallions. And as we discussed, a comprehensive neurological exam is also really key, especially if there's any sign of incontinence or difficulty urinating.
Right. What about lab tests? Urine, blood work?
Absolutely critical. Urinalysis gives us a lot of information about urine concentration, pH, presence of blood cells, protein, bacteria. But here's a key point for horses. Finding calcium carbonate crystals in the urine sediment is actually considered normal. Horses just excrete a lot of them.
Oh, okay, so just seeing crystals doesn't mean stones.
Exactly. It doesn't confirm urolithiasis on its own.
Mhm.
So you need more evidence. We also always do a quantitative urine culture, ideally from a sample collected carefully to avoid contamination, and antimicrobial sensitivity testing. This identifies any specific bacteria causing an infection and tells us which antibiotics will be effective. Blood tests are important too, checking kidney function values like creatinine and BUN, looking at electrolytes, and checking for signs of systemic inflammation or infection.
Okay, and then imaging must be pretty important.
Oh, essential. Advanced imaging is really where we get confirmation and detailed information. High-resolution ultrasonography, ultrasound, is invaluable. It's great for looking at the kidneys, the bladder, the ureters. You can often see stones directly, assess the bladder wall thickness, check for kidney swelling. And here's a critical procedural tip. You should always do the ultrasound before any endoscopic exam, like cystoscopy.
Why before?
Because endoscopy introduces air or fluid into the bladder, and that gas can create shadows on the ultrasound that obscure your view, or worse, can actually mimic the appearance of stones, leading to misdiagnosis. So ultrasound first is key.
Good tip. What other imaging?
CT scans, computed tomography, provide incredibly detailed cross-sectional images. They're fantastic for complex cases, like figuring out the extent of kidney stones or tumors, finding those tricky congenital problems like ectopic ureters, especially in smaller horses or foals where rectal palpation isn't possible. And then there's endoscopy itself, cystoscopy, where you put a camera into the bladder. This allows direct visualization of the bladder lining, the urethra, and the openings of the ureters. It's considered the gold standard for identifying things like ectopic ureters, and it also allows the vet to take targeted biopsies if needed, or even remove very small stones or fragments right then and there.
Okay, so a combination of history, exam, labs, and imaging really builds the picture.
Yep.
Once you have a diagnosis, how are these stones usually treated? Is surgery the main route?
Generally, yes. For most equine uroliths, surgical intervention is considered the primary and often the definitive treatment. And that's largely because, as we mentioned, the most common type, calcium carbonate, is highly resistant to medical dissolution. Unlike some stones in dogs or cats, you generally can't just dissolve these with diet or medication in horses.
So medical management doesn't really work for getting rid of them.
Not usually for dissolving existing calcium carbonate stones, no, but medical management definitely plays a crucial supportive role, mainly in prevention of recurrence and controlling symptoms. Diet is key here, trying to reduce calcium intake, especially cutting back on alfalfa and other legume hays. But again, it's challenging. We might try to acidify the urine using agents like ammonium chloride or ammonium sulfate, but hay and pasture, which make up most of a horse's diet, tend to buffer the pH, making consistent acidification really difficult. Plus, many acidifiers don't taste great, so compliance can be an issue. We absolutely use appropriate antibiotics based on culture results to treat any concurrent UTIs. And anti-inflammatories like NSAIDs are important for managing pain and inflammation. There are also drugs that can modulate bladder function. Some help the bladder contract, others help it relax, but you need a really precise diagnosis of the type of bladder dysfunction before using them because they often have opposing effects. You don't want to make things worse.
Okay, so medical management is supportive, but surgery is usually needed for the stones themselves. What are the main surgical options then?
There are several approaches depending on the stone's location, size, the horse's sex, and the surgeon's preference and equipment. Traditional open cystotomy involves making an incision into the abdomen, then into the bladder to remove the stone whole. This allows removal of large stones intact, but accessing the bladder this way can be tricky in big adult horses. It requires general anesthesia, and it has a longer recovery time. Laparoscopic cystotomy is a minimally invasive alternative, using cameras and instruments through small keyhole incisions. It reduces recovery time but might be harder for very large stones.
Okay.
For male horses, a very common procedure is a perineal urethrotomy, or PU. This involves making an incision in the urethra, in the perineal region, below the anus. It can often be done with the horse standing, under sedation, and an epidural block, which avoids the risks of general anesthesia.
Standing surgery sounds like a big advantage.
It definitely can be, but the PU procedure does come with its own potential complications, like bleeding during or after surgery, and sometimes the surgical site can heal with scar tissue that narrows the urethra. That's called a urethral stricture, which could cause problems down the line.
Right, pros and cons to each approach. Now, you mentioned earlier that some stones are easier to break up than others. So instead of cutting them out whole, can you break them up inside the horse?
Yes, absolutely. And this is where some really interesting and less invasive techniques come in. That's a crucial question, actually.
Ah, so this is where things get really cutting edge.
Kind of. Laser lithotripsy is one option. Using a laser fiber passed through an endoscope, you can vaporize the stone into tiny pieces or dust that can then be flushed out. This is minimally invasive and can significantly reduce healing time compared to open surgery. But perhaps an even more significant therapeutic advancement, especially recently, has been pneumatic lithotripsy.
Pneumatic, like air-powered.
Exactly. It's a device that uses pulses of compressed air or gas to create shock waves through a probe placed against the stone, fragmenting it. The big advantage here is that it can often be done via endoscopy with the horse standing under sedation, just like the PU. So again, you avoid general anesthesia, which is particularly beneficial for older horses or those with other health issues.
That sounds like a huge step forward.
It really is. And for mares, because their urethra is so much shorter and wider, you can often perform pneumatic lithotripsy without any incision at all, just passing the instruments directly through the urethra into the bladder. That leads to much less inflammation and potentially quicker healing. It's been a real game changer for patient welfare and, frankly, for owner acceptance of treatment recommendations.
Oh.
And while we're talking breakthroughs for those really challenging cases of urinary incontinence caused by urethral sphincter incompetence, where the valve holding urine in doesn't work properly, there's been remarkable success with artificial urethral sphincters, or AUS devices.
Artificial sphincters, like in humans.
Similar concept, yeah. It's an implantable cuff that goes around the urethra. Studies have shown really promising results, with reports of around 70% achieving full continence and up to 92% achieving what's called functional continence, meaning maybe occasional leakage, but vastly improved quality of life.
That's incredible progress. So beyond the surgery itself, what kind of supportive care is vital for these horses during recovery?
Fluid therapy is often fundamental, especially if the horse was dehydrated or has kidney issues. Intravenous fluids help restore hydration, correct any electrolyte imbalances, and help flush the urinary tract. But it needs to be administered carefully based on the horse's specific needs. Pain management is also crucial. Both the underlying condition, like a UTI or the stone itself, and the surgical procedure can be quite uncomfortable. So effective analgesia is key for welfare and recovery.
Right.
And a really big one for owners, especially with incontinent horses or after certain surgeries, is managing urine scalding. That constant moisture can cause painful skin irritation and dermatitis on the hind legs and under the tail. It requires really diligent daily cleaning, drying, and application of barrier creams. It takes a significant, dedicated commitment from the owner to prevent severe discomfort and secondary skin infections.
Yeah, that sounds like a lot of nursing care involved. So thinking long term, what's the general outlook for horses diagnosed with urolithiasis? Is the prognosis usually good?
It really varies widely depending on the specifics. It's generally favorable if the underlying cause is something straightforward and correctable, like, say, a single bladder stone that can be completely removed without complications and there's no permanent damage. However, the outlook becomes much more guarded or even poor for cases with long-standing incontinence, especially if it's due to that irreversible bladder paralysis, the atony we talked about. Or for horses with significant kidney stones, nephroliths, because those can cause permanent kidney damage leading to chronic kidney disease.
So early diagnosis is key.
Absolutely critical. Delayed treatment just allows more time for complications and irreversible damage to occur, which significantly worsens the long-term outlook.
Okay. And once a stone is treated, how big of a concern is recurrence? Do they often come back?
Recurrence is definitely a significant concern, yes. One of the most common reasons for stones seeming to come back quickly is actually incomplete removal in the first place. If even small fragments are left behind, they can act as a nidus, like a seed crystal, for new stone material to deposit onto, allowing a new stone to form relatively rapidly.
So getting it all out is crucial.
Totally crucial. Other factors contributing to recurrence include ongoing dietary issues like continued high calcium intake or inadequate water consumption leading to concentrated urine. And of course, if there are underlying conditions that haven't been resolved, maybe persistent bladder dysfunction, chronic infection, or that urethral stricture after surgery, those will also significantly increase the risk of stones forming again.
Right. So that brings us back to prevention. Given that recurrence is a risk, how do we best try to prevent stones from forming in the first place, or from coming back after treatment?
Well, prevention really needs a multifaceted approach. Dietary management is usually the primary focus. Reducing dietary calcium is key, which often means switching away from alfalfa or other legume hays to grass hays, and carefully evaluating any supplements. And ensuring adequate access to clean, fresh water at all times is critically important. Keeping the horse well hydrated dilutes the urine, which makes it harder for crystals to concentrate and aggregate into stones. It also helps flush the system and reduces the risk of UTIs.
So diet and water are the cornerstones. What else?
Regular monitoring is also really important for horses with a history of stones. Recommendations often include biannual veterinary checkups, perhaps including rectal palpation or even ultrasound or cystoscopy. The idea is to catch any new stones when they're still small and immature, because they're generally much easier and less invasive to remove then, compared to waiting until they become large and problematic again. And, circling back, promptly diagnosing and managing any underlying issues like neurological bladder dysfunction or that chronic musculoskeletal pain affecting urination posture is vital to prevent the progression to more severe problems like sabulous cystitis and irreversible bladder damage.
It really sounds like a holistic approach is needed. Thinking about recent developments, what are some of the most exciting advancements you've seen in this field lately, either in diagnosis or treatment?
Yeah, there have been some really neat innovations. In diagnostics, beyond the improvements in high-resolution ultrasound and the accessibility of CT, we're seeing things like multi-slice CT urography. This technique involves injecting contrast dye and taking rapid CT scans to watch how the dye moves through the urinary tract.
Oh, cool.
It's incredibly precise for identifying subtle problems like ectopic ureters, even better than standard CT sometimes. And for detecting infections much faster, there's a technique called loop-mediated isothermal amplification, or NOMMP.
OMP.
Yeah, it's a molecular technique that can detect bacterial DNA very rapidly, sometimes providing results in under 20 minutes right there in the clinic or field, compared to waiting days for traditional culture. That allows for much faster, targeted antibiotic therapy, which is great for the horse, and also really important for antimicrobial stewardship, using the right drug quickly and avoiding unnecessary antibiotic use.
Wow, 20 minutes is amazing. And on the treatment side, what's really pushing the envelope?
Well, regenerative medicine is an area of active research. Things like stem cell therapy are being explored for their potential to help regenerate damaged kidney tissue, although that's still quite experimental. But as we discussed earlier, the biggest impacts recently have probably been in minimally invasive surgical techniques. Pneumatic lithotripsy, in particular being able to fragment stones in standing horses, has significantly improved patient welfare by reducing invasiveness, avoiding general anesthesia risks, and shortening recovery times. That's made a huge difference in practice.
Definitely sounds like it. So looking ahead, what's next on the horizon for equine urolithiasis research?
Yeah.
What are the big unanswered questions or future directions?
Well, there are still definite knowledge gaps, particularly in fully understanding the complex pathophysiology behind some of these equine urinary disorders, like why some horses develop bladder atony and others don't. Research is ongoing into areas like gene therapy and tissue engineering, exploring ways to potentially repair damaged urinary tract tissues more effectively. And there's also a really urgent need for better evidence-based guidelines on antibiotic use for UTIs in horses. How long do we really need to treat them? We extrapolate a lot from small animals or humans, but horses might be different. Optimizing antibiotic durations is a critical area for antimicrobial stewardship globally, and we need specific data for horses.
Absolutely. Well, we've certainly taken a deep dive into equine urolithiasis today. We've gone from, microscopic crystals all the way to these really cutting-edge surgical techniques. It's really clear that this isn't just about a stone, is it? It's about a really complex interplay of the horse's unique physiology, its anatomy, its diet, its environment.
Exactly. If we try to connect this all back to the bigger picture, I think the key takeaway is that early detection and, critically, a precise diagnosis are paramount. And then management requires a tailored, comprehensive approach. It often involves significant owner commitment, especially for prevention and managing chronic issues. And realizing that strong link between seemingly unrelated problems like subtle neurological signs or chronic back pain and urinary health, it just reminds us we always need to look at the whole horse, all its interconnected systems.
That's a great summary. So what does this all mean for you, our listener? Maybe the next time you're watching a horse, you'll think a bit more about how vital those seemingly normal urinary habits actually are. And maybe you'll appreciate how even really subtle changes in those habits could potentially reveal something important about the animal's overall well-being. It makes you wonder, doesn't it? What other complex aspects of equine health might be hiding in plain sight, just waiting for their own deep dive?